This is the angulation. See, patient is lying down in supine positioning. Sometimes we need to give caudal angulation or cranial angulation. Sometimes what will happen when you take a radiography, see in a chest example, chest radiography, sternum is overlapping below part. Now you wanted to see something about mediastinum, the sternum will be overlapped. You wanted to avoid such time, or ribs, sometime rib, a small nodule is there, but rib is overlapping on that. If you wanted to avoid, we need to give angulation to avoid that rib overlapping on the nodule. So that time we will give angulation, that is what is called angulated view. Cowed view, see here in this image we call 30-degree cowed angulation. Some of the radiography is there, we should give some 30-degree angulation, 40-degree, 45, 50, it depends on the positioning. So 30-degree angulations means, now you can see here is supposed to be X-ray tube in, there is a dotted line supposed to be straight, X-ray tube if it is straight. Now when we give 30-degree and cowed means towards foot. If it is the rays are turning towards the foot means it calls a cowed view. If it is the same thing opposite to this, if it is 30-degree angulation towards head, is called cranial angulation, or we will call a cranial angulation. So that is what two different angulations will be there. That is manipulated in the X-ray tube. Angulation we will give through the X-ray tube. So these are different terminologies of projection and positioning terminology. So don't get confused. Go through this image once again. Then see, don't get confusion in it. So how image will form? Just a small, I'll not go much about physics behind this. Now see, this is the one patient body is lying down and this thing. Now you think this is the cassette. This is the cassette. Okay. This is the cassette. This is the X-ray tube will be here. When X-rays pass through the patient, now here there are only two different parts. One is bone, one is lung, and this is all soft tissue usually. Example. So when the X-rays pass through that X-ray pass through the patient, whichever X-ray is reaching to the cassette depends on atomic number of the patient body. So bone will be having high atomic number. So if high atomic number is there means the X-rays that absorbed by the bone, it will not allow much X-rays to pass through the bone. See, the atomic number means, example, one something has a atomic number about 50. If 50 is there, the more than that energy X-rays is there, only it will pass through that part. If it is 60 is there means it will pass through that part, pass through that bone. If it is 40 is there means the energy of the X-rays, if it is 40 is there means what will happen, it will be absorbed by the bone. That's why here you can see in the image receptor, when it's reached to the cassette, here low density will create, because some of the X-rays is absorbed by this bone, and only it will allow to pass the more than energy which is there in the bone, that will reach here, lowest energy. But in lung, what would be there? Usually it will be the air. So air, if it is there means what will happen? X-rays will not, because the air atomic number is very less, very less. So most of the X-rays will pass through the air and it will reach to the image receptor. So that's why here high density. The same thing, see here patient hand, if it is kept and taken a radiography means we will get a radiography image will be like this, because this bone, most of the X-rays is received absorbed by this bone. Here in this part you can see here only air is there, air will be there. So most of the X-rays will reach to the cassette. If it is most of the X-rays reach to the cassette means more darker. If it is less X-rays reach to the cassette means it will be less darker. So that's why how image will be differentiated. See here, three different. If I take this is the bone, this is the soft tissue, this is the air. See air here, because there will be, I already told you, the atomic number is very less. So most of the X-rays will reach to the cassette, that's why it will become dark. Here in soft tissue, some of the rays will be observed by the soft tissue, that's why it will slightly less darker than the air area. Here is a bone, because this is the density part, so there some of the X-rays is observed, so that's why that looks like a brighter. And almost I am an end to the presentation. Landmarks, this is one of the important part in radiography. If you don't know this landmarks, means you will not able to take any imaging of the patient. So here for you is related to the chest radiography, so I'll talk about chest radiography. So whenever you this cartilage, thyroid cartilage, when is a palpable, landmarks means you can touch by outside and you can feel that this is the if it is taking example of the thyroid cartilage, when you touch it you can feel from outside. So it means that level will be at the level of the C5, cervical 5 vertebra. Then here it will be a jugular notch, sternal notch also we call. That means that level will be the vertebral level will be T2 T3 or D2 D3, dorsal or thoracic. Then a sternal angle, you can see sternal angle, this is T4 T5. Then sometime this is inferior angle of the scapula, you can see a scapula will come in this way, like this scapula, this line, black line, inferior angle of the scapula, it will be a T7 level. Okay, this is a xiphoid process. Xiphoid process will be a T9 or T10 level. And inferior costal margin, this is the inferior costal margin. Here this is the inferior costal margin, it means the lung will be get end at this part, it will be L2 L3 level. Then iliac crust, this is iliac crust, when patient is lying down you can feel, we can touch it here, you can feel that there is usually L4 L5 level. So these are landmarks. So when you take a chest radiography, please remember this sternal notch, D2 D3, then angle D4 D5, scapula, inferior border of the scapula, that is T7, and xiphoid process, that is at the T9 T10. This is very important. This is all when you take a chest radiography. These are the different body habitus. According to that, always you should plan keeping the cassette. So that's what I am giving here an example. So here already A, B, C, D, there are 4 different type of body habitus are there. This is sthenic, this is hyposthenic, this is asthenic, and hyposthenic. When you see the patient itself only, what kind of cassette, how cassette can be kept vertically or longitudinally, that's what I am giving example here. See, whenever patient comes, now patient sometime what will happen, patient will be usually hypersthenic patient is there, no? When the patient comes, you feel that patient is so hefty, but their lung field is very small. So that time, if you, this is a longitudinal cassette, this is horizontal cassette. So what will happen if that cassette, if you, for this patient, if you cassette kept in this way longitudinal, there is a chances of missing images at the edge of this images. So that's why think of that and keep the cassette. That's what I given here. But hyposthenic patient is very less, rarely. You can see in the European countries slightly because their body habitus is different, you can see, but in especially in Indian scenario, always you see about asthenic patient, sthenic patient, usually you will see frequently. That is what, think of that and keep the cassette. So here with this I am ending this session. Please go through that. You also can refer book Clack Positioning, or else you can refer from the Merrill's Radiographic Positioning. Merrill's Atlas is different, and Merrill's is the author name. So that is radiographic positioning. Also another book, it is available, Bond Rager. These are 3 different books is available in our library. Please go through that and read it, because this is a important topic for the session.